Radio 1 FM 90.
Spectrum wants to hear your views. You can SMS at any time during the show. Type Spectrum, leave a space, type in your contribution and name, then send it to 7197. Your views, our interviews on Spectrum, Radio 1 FM 90.
Hello, a very warm welcome. This is Spectrum on Radio 1. I'm your host, Edmond Kizito. On Spectrum tonight, how can Uganda improve on its child health care indicators, taking lessons from the past and concerns noted today? Child health is critical in the development of any country, and it is the foundation of a healthier population that can effectively work towards the progress of the country. Given that fact, it is important for any country to plan adequately for the health care of children and their mothers. This year, Uganda is marking 50 years of independence and has been reflecting on several aspects of its health care. One of the facts that emerge when one looks at the 50 years is the fact that along the way, healthcare has been liberalized, and according to healthcare experts, this has somehow encouraged government to relax in some aspects. At the time of independence, Uganda had a small population, but currently the population is increasing rapidly, with government attributing this to high fertility rates and improved child health care. It is also true that some disease situations or healthcare complications that are common today were not present 50 years ago. A quick analysis of child health care in Uganda reveals some critical challenges, including maternal and infant mortality, lack of modern facilities to cater for certain disease situations in children, lack of adequate specialists, to mention but a few. This situation has been complicated further by poverty, especially in rural areas where health facilities that would provide services are poorly facilitated. Child rights organizations insist that child health is a human right issue and are urging government to invest more in child health. So tonight we ask, what is the situation of the child health in Uganda, looking at the past 50 years of independence? Also, what are the current challenges and what lessons can we get from the past to deal with current bottlenecks? Our guests tonight, Dr. Sabrina Kitaka, Senior Lecturer and Specialist in Pediatrics and Adolescent Health at the Department of Paediatrics at the Makerere University College of Health Sciences in Mulago Hospital. You're most welcome, Dr. Sabrina.
Thank you, Edmond.
We're also joined by Hon Sylvia Namabidde, Mityana District Woman Mp and Chairperson of the Network of African Women Ministers and Members of Parliament Uganda Chapter. You're most welcome, Honorable Sylvia.
Thank you, Edmond, and good evening, listeners.
We're also joined by Ms. Ruth Birungi, Program Officer in charge of Research and Information at ANPPCAN, that's the Child Rights Advocacy Group. You're most welcome, Madam Birungi.
Thank you so much. I send greetings to our listeners.
Dr. Kitaka, how would you characterize Uganda's child health care?
Well, thank you very much, and good evening, listeners. First of all, I'd like to say that the child health in Uganda is on an up-go. However, we have not attained our Millennium Development Goals, which are supposed to be achieved in the next 3 years. According to the Millennium Development Goals, we should have reduced our child mortality by at least 2/3, and currently we are at 50 per 1,000 live births. This is unacceptable. Much as the Ministry of Health has worked so hard to reduce our infant mortality rate from a miserable 188 per 1,000 live births, we are now at 50, but we need to go down to about 20 per 1,000 live births. So we are still struggling to attain our Millennium Development Goals.
When were we at 180?
About maybe 6 years ago.
Okay, so there is some progress.
There is a lot of progress, and we really commend the Ministry of Health, but we still need to continue. There are some rates that are not good. For example, the immunization rates are not appropriate. If we look at DPT third dose, we are still at 63%, and yet we are expected to be at about 88%. So we still need to do a lot of work. We recently had a bad measles epidemic. In this day and age, we should not be getting measles measles epidemics in our country. So we still have some issues. If we look at, for example, education among women and children, we are not yet at 100%, and yet we know that education is a birthright. As long as we do not educate our girls and educate everyone in the country, we are still going to continue to have people who are not committed to immunizing our babies, to having large families, and yet we know that all these things contribute a lot to increased infant mortality, increased morbidity and mortality. Our poverty situation is not good. So many Ugandans continue to live below the poverty line. So many Ugandans live on less than $1 or less than 2,500 shillings per day. And yet we don't know that poverty and diseases like pneumonia and diarrhea go hand in hand. So we need to close this gap.
What is government doing all it can to improve the situation?
Well, as far as I'm concerned, the government needs to do a lot more. I mean, we've been crying about the Abuja recommendation of increasing funding to health to about 15%. That is a dream, and our honorable MP can tell us this, that it's a dream that may never come true.
Well, we have oil coming soon.
Well, we do have oil, but the oil is going to be disaggregated into arms, whatever, who knows. And as long as we do not respect that health is important, and moreover that child health is a key aspect of improving our economic rate, then we are not going to move far. I'm sorry.
Madam Ruth Birungi from ANPPCAN, what do you see when you look at the wall, the spectrum?
I would like to add to what Dr. Sabrina is saying. In Uganda, I think we haven't realized that health is a right for the children and for the mothers. And if you look at the situation of health within our country, it is too deteriorating, especially for the children. The mortality rates, much as the indicators are showing progressively, but when you go on ground and see what is exactly happening, the children are suffering, the mothers are suffering. There is no sensitization on reproductive health among the mothers and the children, and these are the core people within the country. If the mother is not educated, is not sensitized on how to deal with health issues, that means that it has an implication on how we are supposed to respond. So I think the government, as the primary duty bearers, they should respond and ensure that the services for children are improved in all aspects, and they increase funding, because there is nothing we can do if we do not prioritize health. And if we have an ill health country, that means that we are not having any development.
Right. I mean, do we have the right information? Do we have the right perspectives, analysis on this? And all we need to do is to provide the money. Are we listening to the right voices? Or are we not? Some people think we should listen to the children as well.
Sure, because the children are the key. They are the key duty bearers, as in they are supposed to they are the people who benefit, and they should be listened to. We are accountable to them as the government, as the people who provide services. So if they do not take part in decision making and in perspecting in things that affect them, that means that there is a problem. So we need to involve the children, the mothers, all the stakeholders, right away from the grassroots level.
Honorable Namabidde, what should we do at this moment in your view?
First of all,
strategically, so we can change a lot of things at the same time.
I'll talk both as a political leader and also as a public health advocate. We have a lot of work to do at both levels, both as leaders in government, because like Madam Birungi has said, government is the primary duty bearer, and definitely children are our responsibility, and we must do everything possible to make the lives of children decent, and as government, and this must be reflected in the way we budget, the money we put into health, because when children are under 5 years, there's a lot of resources must go into ensuring that they're healthy, that when the mothers are pregnant, because when we look at a child, we go beyond the physical child you see, but we also look at an unborn child who must be protected within the mother's womb. So pregnant mothers must be supported, must be given the adequate care, must be enabled to access a skilled attendants at birth. They must be taught that they must immunize their children. They must be supported to breastfeed their children. They must be supported to provide nutritious meals for their children. They must be supported to have water, safe water during pregnancy, safe water during birth, safe water after childbirth, because children, and the doctors will tell us that many of the childhood, the dangers children face, it's because of poor health, lack of clean water, lack of clean environment. So as government, it's our responsibility to ensure that the environment under which children are conceived, under which children are born, under which children grow, is a protective environment for our children. And this means that we have to increase allocations to health, the health budget. And as Dr. Sabrina said, as a country, we are far away from reaching the agreed target in Abuja of 15%.
So we should buy less arms or spend on health.
We should balance. We should balance. Actually, what has been in Parliament, we have been. I said that sometimes I find myself in a very difficult position to talk both as a political leader and moreover one who sits who is in a ruling party, but also as a person who passionately advocates for health. And these are the challenges which we are confronted with even in Parliament. When you're in government, but you say, can we increase our allocation to health? Because even as a political leader, when I'm in my constituency in Mityana, when I interface with the population, they'll talk about everything. Yes, we are grateful for the peace and security, but health, people want to see drugs in their hospitals. They want to see improvement where they deliver their children, maternity centers. They want to see, a woman wants to go in a hospital and she's welcomed and she's assisted to deliver her child. And she's even welcomed back. She's given the appropriate information. So really, these are things which are close to the hearts of the people we represent. And good leaders must respond to the real needs of their communities and their constituents. So, as the government, we still have a very important role to play to ensure that we put in place an environment where our children can grow well and grow up into the kind of human beings we want to see in future.
Well, listeners, this is Spectrum on Radio 1 tonight. How can Uganda improve on its child health care indicators? Taking lessons from the past and concerns noted today. We will be able to call in and contribute at some stage. Our guests tonight, Hon Sylvia Namabidde, MP, Mityana District, also chairperson of the Network of African Women Ministers and MPs Uganda Chapter, Dr.Sabrina Kitaka, very well-known personality, senior lecturers in pediatrics and adolescent health at Makerere and based out of Mulago Hospital, and Miss Ruth Birungi, information research and program officer, research and information at ANPPCAN, that's the Child Rights NGO. Dr. Sabrina, should healthcare be largely left to this private sector? The history is that the Catholic Church, the Anglican Church, gave a strong background to health, public health. Should we continue that way?
That's a difficult question, and it could probably take maybe 2 hours to answer it, Edmond. However, I strongly believe that we need to look at a partnership. We cannot look at the private sector in isolation. The biggest amount of money really goes to government. So we need to look at a partnership that includes and involves and engages all key stakeholders, including government, private partnerships, non-governmental organizations, not-for-profit organizations, the civil society. I think that if we all work towards the same goal, then we are going to achieve a lot. We cannot put it towards just one partner.
Shine for us the torch 50 years ago,
okay.
Specifically about child health. What used to happen then, what is happening now?
Probably what I can shine a torch on is about 20 years ago, because clearly I'm not 50 years old. Okay, yeah. But the truth is, 20 years ago, we had more child deaths globally. In 1990, there were about 20 million, children who died, and in 2010, there are just about 7.6 million children who died. So things are improving. We know what to do. There are more interventions which work. Interventions like immunization, interventions like cesarean sections, improvement of our road network. All these things have changed. In the past, if a mother lost a baby, they'd, say probably it's witchcraft or something, but now we know what to do. Today we know that we must have simple public health interventions that can improve on our public health. But also, we do know that there are other diseases that have come in. 50 years ago, HIV did not exist. Today, we do have HIV, and we have diseases like Ebola and Marburg, and the world has become a global, a global village. Today, I can be in Kampala, and tomorrow I'll be in London or New York or wherever. So time moves and time changes are very, very short. So diseases can transfer very rapidly from one continent to another. So if we compare what happened 50 years ago when we had very little, we were poorer, there was more poverty 50 years ago. Today there is more wealth, but again, as I wanted to emphasize, the difference between the rich and the poor is becoming bigger and bigger and bigger. If you look at the G8 countries, for example, Japan, their infant mortality rate is 0.6 per 1,000. I mean, that's remarkable. Like nearly, no child should die before the age of 5 years in Japan. Whereas in Uganda, if you compare to what we were about 3 years ago, that was 90 per 1,000. You just see the difference. And also, if you look at the urban areas compared to the rural areas where the MP comes from in Mityana, you cannot compare the infant mortality rate in Mityana versus that one in Kampala.
What are the figures? Do you have some?
No, unfortunately, I don't have the exact figures, but the Uganda Demographic Health Survey has recently been released, and we can refer to it for detail.
Dr. Honorable Namabidde, do you have some figures what government used to spend in the past in terms of proportion to what they spend now, 9% on health?
Really, the figures have been staggering. I think the highest spent on health about 3 years ago was about 12%.
And it quickly dropped to 9.6.
Yes, it dropped, and then it dropped again this year to 9 point something, like 6%. So it has been staggering around that. And actually, when it rose to 12, we said, yeah, we are moving in the right direction. But unfortunately, it staggered back. Much as government, the Minister of Finance sometimes says that, the percentage may drop, but the actual amounts are going up because every year...
it's really the proportion that matters.
But also, if really we spend 15% of our budget on health, different to the transformation, would be enormous. So it's about an issue of priorities. It's an issue that we've not yet realized that when you put money in health, it can yield returns. that when you invest in health, or when you put money in health, it's an investment, like any other investment. Like you invest in security, like you invest in industries, investing in health can yield dividends. That is a statement that we are yet to, I don't know how we shall frame it, such that the economists in the Ministry of Finance realize that it's important to increase money in health.
And then you get the 15%. Where would you be spending? Buildings or what?
Definitely around the whole continuum of care. Because we need the buildings, definitely. When, if you look at, when I look back in my district.
And better salaries for people like Dr. Sabrina.
Definitely.
They don't go to work in Paris.
Yeah, so we need the buildings, because the doctors and the health workers need a good working environment. Actually, when you relate with doctors and health workers, salaries don't come as number one, but the working environment.
True.
You know, Dr. Sabrina would love to, if I take my child to her, she would love to have everything she requires to restore the child's life. We share with them, and they tell us how devastating they feel when a life is lost.
That's true.
On their hands. Or when they feel,
if you know that you could have saved this person.
When you feel so helpless and powerless to save a life, when you could save it. So we need money. We need money to improve the working environment. We need the money to have the health centers, have the drugs in the hospitals, and all the commodities, the equipment, the drugs, and all these supplies. Then the salaries, it's very important that I think Uganda is one of the countries where our health workers are paid.
Offer the pittance.
Yes, and it's no wonder that many of our health workers have left Uganda to greener pastures. They have gone to Rwanda, they have gone to down south, and yet what hurts me most is that we as a country we train them. And we are supposed to train them to receive something in return, but we don't value them after training them. And definitely,
and they have families.
They have families. They want to educate their children in these elite schools where all of us educate our children. They want to take them to universities where we take our children. So really, another very big important area where we need to invest is health workers' remuneration and conditions of living.
Madam Birungi, talk to us about what civil society is doing about all this imbalance.
About before.
Well, we put money in other places, forgetting about health.
Not really, because.
Well, the government is not spending enough on health. It's been going down 12%, 9% is now lower. What are you people doing about it?
The civil society, I think our role is to help the government realize that it is their responsibility to provide health services to the country. Because much as the civil society comes in to support, it is a mere support and it is not sustainable. I think our focus should be on how can we help the government to build a strong health system. If, for example, you are taken to Canada in a hospital, you would feel like you want to be there. But if you come in Uganda and you're taken to Mulago, you want to escape. Why? Because the government has built a strong health system it is proud of. But when we look at our situation in Uganda, I appreciate that we are really progressing, which is good. But when we do a comparative analysis with what is happening in other countries, there is still a lot we need to do. And our role as a civil society is to show the government that this is actually what is happening. This is we
haven't seen you demonstrating. When they spoke about corruption, you had placards at Humaga. We haven't seen any placards on child.
We don't need to demonstrate, because we believe that partnership is the best way of improving things.
All right.
When you do the criticizing, may it not help a lot, but we need to partner with the government and show them that this is actually what we need to see happen. When we look at what happens in the villages and how many mothers are dying when they are giving birth, it's still
we'll talk about those details. You don't like to lecture leaders in public. You talk to them in private.
We do both ways.
All right.
We do public and private, of course.
Listeners, this is Spectrum on Radio 1. We'll be back after this break. To stay tuned.
Discover the new invigorating taste of Red's Vodka Lemon. Red's Vodka Lemon. Reinvent the night. Not for sale to persons under 18.
It's the time again to sweat a little for better. It's that moment to unite again and open our hearts to charity. Run for life, run for water, run with your heart, run with your heart, run for life. Register and run the MTN Kampala Marathon on the 25th of November and help take clean water to Bududa. Run with your heart.
MTN. Everywhere you go.
Excuse me, guys. Let me through, please.
Yes. What? Check this guy. Goodness, dude, what are you doing? Get real.
Just move
Just
a little.
what?
A little bit.
Man, what are you doing bringing a cow into the sitting room?
It's just for when I want milk.
Just what?
Just please move. Let it come and sit here.
What's wrong with this guy?
You cannot keep a cow in your home, but you can get the freshness of its milk straight from the farm into your home. Get fresh dairy milk for freshness straight from the farm every day. Fresh Diary, so fresh.
Spectrum on Radio 1 FM 90.
Because of corruption, 1, 2, the increasing number of children, and the doctors are not enough compared to the number of patients they tend to. The population in Uganda is high.
Their services are limited. They don't outreach in the community. They're always in the main hospitals.
Of course, we don't have adequate doctors. We don't have first-class hospitals. We don't have even equipped health care centers. We don't, which can be beneficial to child health.
Bribing in the hospitals, there's no medication. If you don't have bribe in a hospital, you don't get a proper treatment. So that is the problem in the hospitals. It will not help us, both mature people and the children.
The thing is actually it's working only in towns. But when you go to the rural areas, for example in the villages, really it is very poor. People are suffering. It's not there.
Views from you, some of the views that we had from you on this topic. This is Spectrum on Radio 1 tonight. How can Uganda improve in its child health care indicators? Taking lessons from the person concerned noted today. Our guests tonight, Dr. Sabrina Kitaka, Senior Lecturer and Specialist in Pediatrics and Adolescent Health at the Department of Paediatrics at Makerere University College of Health Sciences in Mulago Hospital. Hon Sylvia Namabidde, Mityana District Woman MP, also Chairperson of the Network of African Women Ministers and members of Parliament Uganda Chapter. Ms. Ruth Birungi, Program Officer, Research and Information at ANPPCAN, that's the Child Health Rights Group. You will be able to call in and contribute to this discussion. Dr. Sabrina, can you isolate for us the facets of child care and its uniqueness? How unique is child care? Different, how unique is it from the other? Looking after men for his men's health.
Yeah, I'll tell you that a child in Uganda is anyone aged between 0 and 18 years. And for those children who are less than 1 year, those people cannot speak to us. They come in and they are helpless, and you have to make the diagnosis just by examining the child and listening to what the mom or dad tells you. So children are vulnerable by their very nature. Children have a low immunity, so they are likely to get infections, and many children die before the age of 5 years of common things like diarrhea, like pneumonia, like malaria. So we need to look at this group of people and support them and encourage the parents, because children cannot walk to hospital on their own. So children are unique, they are vulnerable, and people must speak for them. Pediatricians must stand up for them and advocate advocate for them. The civil society must speak for them, because we are the voice of those voiceless children. When you look into the continuum of child health, the adolescents, they are a unique group. I mean, people aged between 10 and 19 are going through a transition process, and they need to be supported to become healthy young adults who are responsible citizens. So we look after a unique group of people.
I mean, if an adult walks into your office, you can they'll have to explain, and you'll be taking notes. You might even be thinking about something else. But for a child, you have to anticipate. You have to think for
exactly.
When they begin to cry, you have to touch them.
You have to know exactly what's going on. If a child walks in limping, you must have a long differential diagnosis. Could it be that she has poliomyelitis? Could it be an abscess in the hip? What is it? If an adult walked in limping into my office, I would think, is this person acting up, or what is it? If an adult says they have malaria, Musuja in Luganda means a lot of things. Innocent, you know, all those things. But if a child has...
when there's no money in the pocket.
Oh, yes. And they'll say, you know, Musuja, when in fact they don't have money. But if a child has Musuja for real, you'll measure the temperature and the fever will be there. It will be
I didn't know about that fever.
Yeah.
Honorable Namabidde, talk to us about these traditional things that we used to do work in the past. My mother gave birth in a health center, but my grandmother probably did not in the early 1900s, so she gave birth to my father. We had traditional birth attendants giving birth under the Chitoke Chagonja. We had, you know, what they call the children, local care for the child. Explain some of those concepts for us. Can they work?
Well, I know that the post still strongly believe in the traditional concepts, the Mumbwa concept, you know, because I even as I walk and past the hospitals, I also see ladies sitting down selling a mumbwa. You know, this is I let people know what a mumbwa is.
It's mixed with
yes,
and sometimes even mixed with paracetamol. You need to register pain.
Yeah. So I think there is people still look at health as a combination. They seek traditional, modern health care, but also practice traditional medicine. And I also know that women still believe that, you know, you can tie a herb around your waist, and it helps you to they call it softening the bones, you know, but dilating the pelvis.
Medically, does it work with psychology?
I don't know. It may be psychological. I think psychological, but when someone strongly believes in it,
you let them do it.
I think they let the health workers. I think let them do it. But I also know the dangers we still have when people still say, I think, that because my grandmother delivered in a banana plantation with a traditional birth attendant, I can still do it. Actually, even in Parliament at that high level, that debate is still going on. Where we still have people at the level of members of Parliament who strongly, when this debate comes up of the traditional birth attendant, people say yes, these women are doing a great work, a great job, you know. Really, it's something we live with, but something where I think our health workers need to come.
But you've been harassing TBAs, the traditional birth attendants. You say you don't want anything to do with it.
Personally, I do it because I've educated myself, and I know that traditional birth attendants cannot handle complications.
Exactly, and they need to be taught how to refer. Traditional birth attendants don't have ambulances in there. Bitoke vya gonja.
Everything is going to be safe.
But I think what we need to do is we need to make them part of the solution. How do we work with them to help the women come and deliver? You know, we have to find out, because if a woman strongly believes in them, the woman will go there. But can they now help us to advise the women to, or even accompany the mothers to go and deliver with the help of birth attendants?
Maybe you should put them on your payroll.
of course, government has this village health teams. I think they can be made, or if they can, they have a level of literacy, they can be made part of the village health team, you know, to walk around and advise mothers to, you know, encourage mothers to go. And because, you know, one of the factors we have which makes mother delay to go to seek care, even when they're going to labor, is because of the mouth porous mothers have.
They have to fetch water.
They have to fetch water. They have to take the goats to graze, and then take them back in the evening. So she waits until the time for getting the goats from the pastures has come. Then she brings the goats back home, and then the children have come back home, and then she goes. But if there's a traditional birth attendant who can, you know, play now a role of a helper.
You know, we don't have enough health workers.
Yeah, who can now help, so remain at home to look after the children and tend the goats, and then escort even the mother to the health center, and then go back home to do the rest of the job.
Right. So you
I think that would be. I think that's something.
You know, some people go to hospitals, instead of doctors they find morticians. A man wearing a gown, he says, "I'm a doctor," and you really do.
Yeah, that's a very big challenge which we have, but definitely we would still encourage mothers to go to the health centers, and we shall encourage the health workers, few as they are, to attend to the mothers.
Madam Birungi, give us some silver bullets if we have to deal with this. Do we have the right policies? What can we do really at the moment, even as we wait for the oil to come 5 years from now, probably?
The policies to address health issues, I think Uganda we are doing well in relation to the laws and policies. We have policies in place. We have adhered to many international conventions and laws in relation to how to address health issues in the country. We have the guiding principles, the MDGs. We have the Millennium Development Goals. Then the UNDP. The UNDP, they have put up the reports to help us, to guide us. But I think we need to go beyond the policies and the laws, and then we look at how are we implementing. How are we going to implement? If we are looking at the maternal mortality rates, reducing them to this level, what are we doing? What have we done? How do we reduce?
Right now it's 435 per 1,000, is that right?
I think it has gone down to 230 something. 236.
That's the latest figure.
Yes.
236.
236.
Yes.
Which is good, but how are we implementing it? What works and what doesn't work? Because much as we are having these laws in place, some are from the outside, the external. How do we incorporate them within our system as a country to ensure they work? For example, we've been talking about the TDS, the traditional birth attendants. They have been playing a core role, by the way, in our health system. And when we look at 50 years ago and where we have reached,
they were the people to know.
Yes, and where we are planning to go. These are the people, and we need to progress. How do we incorporate these ones, the TDS, within our modern health system to achieve the MDGs? Because we can do the training. I have seen a system where these, as the Honorable was saying, the TDS are trained.
Can you standardize them? Can you have guidelines on how to bring them to the sea? You talk about a TBA in Karamoja. Will you be talking about the same TBA in Mityana, for instance?
Sure. We can standardize them, and we train them on how to do referrals. They address critical issues within the community. We teach them how to refer cases, the complicated cases, to the hospital, because they are within the community. We don't belong to the community, and we have not yet developed a strong health system where we can build health centers up to a village level.
5 minutes walk. You don't think we can do that?
We will
reach within 5 minutes of everyone.
We will reach there, but right now we are not yet there.
Dr. Kitaka.
I'm sorry, I beg to differ with Ms. Birungi. I do not encourage mothers to deliver TBAs because of the dangers that we've seen. We've seen mothers coming with with vesicovaginal fistulas. We've seen mothers coming with ruptured uteri. We cannot promote TBAs at this point in time. What we need to do, though, is to encourage government and hold them accountable to build hospitals that are reachable, to be able to reach the unreached, to build hospitals up in the mountains in Kabale or down in the valley in Karamoja, wherever. We must train more health workers and standardize the level of training. We cannot speak of sending our mothers to a TBA who is not educated, who will not understand that, look, this woman has obstructed labor, let me refer her. We cannot speak about that now.
Right, okay. And very briefly, before you hear from the listeners, when you talk about child health, are we still talking about, do we have the maternal health included there?
Of course, we cannot separate. We cannot separate maternal child health.
So one same thing.
Yes.
Well, listeners, this is Spectrum on Radio 1 tonight. How can Uganda improve on its child health care indicators? Taking lessons from the past and concerns. Noted today. You can call in now. Our number is 041-4348-111, 0312 2603900, 0312-261390. When you call in, please switch off your radio if you can and tell us your name and where you are calling from. Those lines are open now. Spectrum, hello?
Yes, hello.
Yes, sir, your name?
Yes, this is Mansur.
Good evening, Mansur.
We need to make up it to our coach. And secondly, I've had the frequent institutions actually talking about
Could you lower the volume on your radio, Mansur? Could you switch off your radio if you can? Okay, go on now.
Actually, actually nobody go to the worker. But it's because of the brutality in the hospital. Let's talk about the story there that when they go there, they actually assaulted by the what? By the nurses. Thank you.
Assaulted by a nurse. Spectrum, hello? Okay, Dr. Sabrina, why do nurses do these things? They hit them. Okay, let's get the calls in first. Spectrum, hello?
Hello.
Yes, ma'am. Your name? Good evening. Your name, madam?
I want to commend the ladies in the studio. Hon Namabidde. Thank you very much for the wonderful advocacy you do. Dr. Sabrina, that's great. However, I want to point out, having said that we cannot separate maternal health from child health. It's true, the two go together. But the challenges we have in this country is too much. I love Dr. Sabrina as a medical doctor. Who knows that she is happening in the community. And she knows exactly the challenges the women go through. That
we seem to have lost you. Can you repeat your point, madam? Yes, go on.
The fact that most women actually to go to the facility, but because of the challenges that we have, trying to make what it means for delivery, with
You seem to have lost you there. Okay, you can still call back in. The numbers are the same: 0414-348-111, 0312-260-390, 0312-226-1390. Spectrum, hello? Hello? Okay, we've lost you. You can still call back in. Dr. Kitaka.
So I heard that mothers go to TBAs because
okay, let's take the lead. Spectrum, hello? Yes, my friend, your name?
Yeah, okay, this is Mansur once again. There's something I wanted to ask.
Yes, go.
We as a professional teacher, actually, we have instruction tips. I wonder whether the medical actually department does also that kind of supervision and inspection. Thank you.
All right, Spectrum, hello?
Hello, which one you want?
Yes, it is, madam. Your name?
Yes, hi Edmond, this is Gloria. I'm calling from Namugongo.
Yes, Gloria.
Now, I wanted to ask, a lot has been said about child health, but nothing has been mentioned about child mental health and adolescent mental health, and I think that also contributes to child health and well-being. Maybe someone could shed more light on that. Thank you.
Spectrum, hello?
Hello, good evening.
Good evening, sir. Your name?
Thank you very much. I'm called George. I want to appreciate the work of Dr. Sabrina and the Honorable Member of Parliament. One problem that we should really notice is that sometimes when we send away women for maternity, to attend antenatal care, the nurses that one caller has already put in touch with the dental handle them. You may buy all other equipment that your wife is going to give birth in the hospital. If she wishes maybe just go to a nurse or a personnel who is supposed to help her, will definitely send her away. Now, what that one really does, if a person comes home to give birth or from home, you may find that the care to get from home is not really good enough, and it could lead to the child maybe being born, the still bad, beginning to still bad because of failure by this unprofessional, what they call the traditional birth attendant, or it can lead to transmission of very diseases like pregnancy, all these kind of things that we have health workers who are really, I don't know whether they are trained or they really want to punish fellow women, because most of these nurses are women. So there should be a way that the women, these nurses should be trained how to handle these women, because a woman who is in a labor, if loses her mind, and these nurses tend to really harass them so much. Thank you so much.
George, thank you. Indeed, all mothers are women. Madam Sabrina Kitaka.
Just for the listeners' information, I'm a mother too. I'm a mother of 5, and therefore I appreciate all that these women have gone through. Giving birth is not a simple challenge. It's a really difficult challenge. I really feel bad when a midwife yells at a mother. I believe that at the medical school we teach compassion, we teach beneficence, and we teach empathy. Therefore, we would like that the midwives, the nurses, the doctors, whoever interacts with our patients is compassionate and kind. But the problem is many of our midwives and nurses have a big patient load. This poor nurse or midwife is helping 80 mothers. Can you imagine helping 80 mothers? Before they know it, they have a slipped disc, they are frustrated, they haven't been paid, they are challenged. And even if you tell them, keep smiling, smile, I mean, she's smiling with no food, she's hungry, and you're telling her to smile and be compassionate. So it goes back to our government. Increase remuneration of the health workers, increase the numbers of midwives who are in the hospitals. I mean, it's a challenge. You cannot expect this poor midwife to take care of 80 mothers who are all pushing babies and keep smiling. And the other thing is,
mental health.
The mental health, yes.
Child, mental, and adolescent.
Child health and mental health. There are many child health problems, including mental health, cardiac diseases. There are so many problems. But I really want to bring to your attention adolescent health. Adolescents are a group of people who have completely been neglected in our health system. If you're 12 years old and you come to Mulago, we probably won't know where to admit you. You'll end up on a geriatric ward where there are grandmothers and great-grandmothers.
Geriatric, that's for the old.
Yeah, elderly people. And so we are pushing to see that adolescent health is understood and developed in this country.
Madam Birungi.
I appreciate listening to the viewers where they are saying, when the doctors are in their lab and in the hospital, sometimes what goes on ground is you can't capture it. The social workers, we know the realities of what goes
Tell us some of those realities. Talk to us.
One of these issues is this, the process, for example, a delivering mother who is coming from the village going to the hospital, what they go through. The health system in Uganda is in a way that we are almost relating it to the police. Why? Because these doctors are overloaded, they have a lot of work, the patients are very many, the government has not intervened in to give enough
money to facilitate them.
And as they were saying,
Yes.
this is actually what really happens. They fear going to the hospital. The health-seeking behavior has deteriorated because they fear going to the hospital.
Because they are at home and pray.
Yes, and the nurses, it's not their problem. Imagine even if you are the one, you are a human being, you have to attend around.
Well, but some of them come in the morning. At least the mood should be good.
They do.
I'm sure it's good. I'm sure
it's very good. But as they attend to those very many people, those many mothers, those many patients, the mood changes. And what is the impact on a patient who is going to seek health care? Because some of our mothers rely on information that is taken back. I've just delivered. What my neighbor will tell me is what I will take. I'll say I was mistreated, and then at the end of the day, they don't want to go back to the hospital. So what do we need to do? I think it is the priority of our country. We should take health as a right and an appropriate investment for the nation. If we do not put enough money into the health
there's a problem.
The problem will keep on reoccurring. We shall say the ideal, this is what is supposed to be done, this is what is supposed to be done, but on reality,
we do other things.
Really deteriorating.
Honorable Sylvia.
When I speak about this issue, it's an issue I've taken keen interest into, both as a mother, because as a mother of 4.
Only 4?
I delivered.
With your salary?
By the time I started having this salary, I had wound up the business. But I delivered 2 of my babies in a public facility and 2 of them in a private facility. So I've had the experience of interacting with health workers as a mother in labor, as a leader, and now as an advocate for health. And really, I know that there are so many health workers out there who are doing a good job. Actually, when we go into this debate, sometimes I'm accused by fellow politicians of defending health workers, because sometimes I come out passionately to defend health workers, because I know there are so many of them who are doing a commendable job in very difficult circumstances. And at the same time, there are some who are not doing a good job, maybe because of personality factors, maybe because of workload, maybe because of lack of support, etc. So this is an issue which really we need to look at on both sides. Yes, government must do its part to ensure that the environment is conducive. That these are people who burn midnight candles, to produce a doctor. By the time Sabrina became a doctor, she had burnt so many midnight candles, and really they need to be appreciated. They need to be supported. They're highly skilled, and they need to be put in an environment where they can, smile. So they need to get that support. They need to get a good salary. But on the other hand, I think they also
should also be patriotic.
The people skill. I think they need to be during training. They need to be taught people skills, how to handle, to relate with people in whichever circumstances they came in. I know when a woman is in labor, and we've gone through it, and sometimes you lose control over yourself. So,
but also I just wanted to make a small point that maybe some people go into the health profession not because they want to be health professionals, but because it's the last resort. For such people, then it's a problem for them to relate to patients.
All right. Just before we go, Mansour asked about inspection teams, paralleling it with the education sector. Do you have this practice?
Oh yes, we do.
Explain to us. I know you have.
I think that the health sector is one of those. Like somebody mentioned, it's like the military. We have hierarchies. We have senior consultants, right down to the intern, the medical students. We have matrons who have double stars, 3 stars, 2 stars, 1 star, yellow belts. So it's a whole big mix of hierarchy. So there's a lot of supervision.
A little bit like the military, we know about generals. Thank you very much. 1 star, 5 star. Miss Ruth Ruth Birungi, Program Officer, Research and Information at ANPPCAN, as a child rights group. You're most welcome. Thank you for coming to Spectrum tonight. Hon Sylvia Namabidde, Mityana District Woman MP, also Chairperson of the Network of African Women Ministers and Members of Parliament Uganda Chapter. Thank you for coming to Spectrum tonight, Madam. Dr.Sabrina Kitaka, Senior Lecturer and Specialist in Pediatrics and Adolescent Health at the Department of Paediatrics at the Makerere University College of Health Sciences in Mulago Hospital. Thank you for tuning in. I've been your host, Edmond. So Spectrum will be back tomorrow. Up next is the news in English.
The Western Union Choma Hour is here. Win lots of goodies this festive season. Listen to your favorite radio station for the Western Union